Hey guys, welcome back to my channel. Today I'm going to be talking about lower limb Doppler assessments for diagnosing PAD or peripheral arterial disease. And you might ask, what gives you authority to do this? Well, I just had a volunteer clinic in which I assessed over 60 patients with a Doppler and gain experience in this area. Currently working with a doctor who treats diabetic foot ulcers, and so I get to see peripheral arterial disease a lot in the clinic, because sometimes the ulcers that come are not diabetic related; they're low circulation issues related, like peripheral arterial disease. And honestly, diabetic foot ulcers and PAD, they go hand in hand because of the lifestyle that people live when they have these diseases. So one thing, before I get to the Doppler findings, which I'm going to get into, I want to talk to you all about PAD. This disease is clinical. The findings are going to be clinical for the most part. You're going to be able to see the effects of PAD in a patient. One is skin findings. Where you're going to see on the skin, you're going to see darkened lower limbs, specifically calf down. At least this is my experience. From my experience, you're going to see edematous limbs that are swollen, tender, painful as well. One thing you want to make sure you do is you want to check pulses. You know, popliteal pulse, the dorsalis pedis pulse on the feet. There's some other arteries there, like posterior tibial, that you can check as well. And now I'm going to start touching on the Doppler sounds. One of the sounds that you're going to hear when you're assessing arteries using a Doppler, specifically without a monitor, you're going to hear a triphasic sound. And so triphasic sound, it's exactly what you would think. You're going to hear three different sounds, and it's going to recognize audibly. Some Dopplers will show this waveform on the screen. This green line is a baseline. This is forward flow, reverse flow, forward flow, reverse flow. And what this triphasic sound indicates is normal flow. This is the sound you want to be hearing. It means no stenosis and no obstruction. Alright guys, so the biphasic waveform is going to look like this on a graph, and it's going to sound exactly like you think it will. At the end of each segment of each waveform, I'll have the actual sounds, but it's going to have two distinct sounds, like, and you'll be able to recognize it audibly, especially once you have some hands-on experience. And it represents loss of elasticity and low-grade stenosis. Alright guys, so the final waveform that I've experienced is the monophasic waveform. And as you can see, this is the waveform on the screen. This green line is the baseline, and you've seen both of the waveforms that I showed y'all in the previous waveforms cross the baseline. In this case, it does not cross the baseline. And what this waveform indicates is obstruction or critical stenosis. So guys, these are the three waveforms that I wanted to show you for Doppler assessments, particularly in my experience for peripheral arterial disease. So we went over the triphasic waveform, which is a good one. There's no obstruction. Biphasic, which is not as good, is maybe the beginning of hardening, loss of elasticity in the arteries. And then there's a monophasic, which is not good. So I hope you all enjoyed this video, and I hope you all learned. And if you guys did, please like and subscribe and comment down below if you have any comments. I will be doing more videos, so please stay tuned. Peace.